So, folks, Christopher Brownlee here, the carnivore lawyer ready for Congress, and I have a lovely guest. I have the Miss Sabrina, Dr. Sabrina Solt, who is a very well-known regenerative functional doctor for the carnivore community, but she's also a personal doctor to me because she healed some of my back problems, and I had a big pain in the ass, and she was my cure. So, I'm gonna get her background, and she's gonna talk about not only her background but her journey into the carnivore diet, but also what she does because part of my campaign is promoting a meat-based diet. But I love functional medicine, and so does Bobby Kennedy, as I discuss it with him too. So once again, Dr. Solt, thank you for joining us on the podcast.
Well, thank you so much for having me. Honored to be here.
Perfect. So I'm going to try to shut my mouth and open up my ears a little bit more. So let's do this. Why don't you give me a brief background about you becoming a doctor?
Yeah, so I'm actually trained as a naturopathic doctor, and my kind of route into that was I always wanted to be a doctor. And when I was in college, I was doing my undergrad, and we had this person come in, and they gave us a talk all about what naturopathic medicine was, and it landed for me. The whole idea that we can figure out the root cause of what's actually wrong with the person and treat them at the level of the root cause versus just giving medications or surgeries as a band-aid. I was like, well, that's what I need to do. Like, that's what I want to be doing. I want to actually heal people. So fast forward, go through school. And as I was coming out of school studying for boards, it's one of the most stressful times on the body. I went through this total hormonal crash. I gained a bunch of weight. I was super tired, sleeping all the time, had no energy, felt terrible. And that's where I kind of got into the whole hormone side of things. And a big part of my practice now is hormone therapy. Around that same time, I was also getting into regenerative injections. I was a former athlete. Actually, I played soccer, I played volleyball, and I've also done 4 fitness competitions. So I'm not a stranger to the gym, not a stranger to exercise, and I had a bunch of injuries. And so I found out that you could perform regenerative injections, and I was on a rotation where I got the privilege of treating a guy's shoulder. And over the course of several injections, we were actually able to not only get him out of pain, but prevent him from having to have a rotator cuff surgery. And after that, I was kind of hooked. So all these things kind of happened all at once. And that's kind of how I ended up building what it is that my practice does, which is predominantly regenerative injection therapies, hormone therapy. We also do a lot of peptide-based therapies, some nutritional IV. But then where carnivore came in was probably about 3.5 years ago now. And it came because I was sick. Of course, most of us come to carnivore because we were
Yeah.
sick at some point, right? People don't just wake up one day and say, you know what, I'm just going to only eat meat for the rest of my life. Like, there's usually something that drives you to get to that point. And for me, it was chronic gut issues that had been around for decades. I was getting acne as an adult. I had really bad anxiety, and I had severe chronic pain myself. I was a mess. I wasn't exactly the picture of what it was that I practiced. And it got so bad that, to the point, I was like, let's give carnivore a try. I was like, what's the worst that I have to lose at this point? Because up until then, I was doing all of the things that I was taught, which was double down on the plants. I was trying to get 10 different plants every single day. I was putting spinach in everything. Like, you would not believe the places that I would put spinach. I would make smoothies, I would make pancakes, I would make spinach waffles, eat spinach salads, like thinking that I'm doing the right thing. I'm getting all these good nutrients. And fast forward, I start doing carnivore. Within 6 months, all of my issues went away. My gut issues healed, my anxiety went away, my chronic pain was gone, the acne that I was having for years was completely gone. And needless to say, I was a complete convert. I became a speaker on behalf of carnivore. I started educating on it. I started teaching my patients about it, doing podcasts about it, creating content around it. And it's really just been this big passion of mine to teach people about, because I felt like I was misled on what actually constitutes a healthy diet. And this came from my education as a naturopathic doctor. So that's kind of the quick and dirty of my story.
Great. So, how long have you been, main? I'm not gonna say like completely strict, because I'll be honest, I have tequila every 2 weeks. It's kind of like a thing. It's steak and tequila. And I'm not gonna talk about my dating life too much, but it's a good little combination with Dave. But anyways, so how long have you been mainly on carnivore?
It's about been almost 3.5 years. I would say I was really strict for probably almost two, no, almost about a full year and a bit on that. I became less strict when I got pregnant, surprisingly, on when I was on carnivore, and that was in it would have been the beginning of 2023, so almost 2 years ago that I got pregnant with on it.
That's not too surprising if you're pregnant.
It's
I mean,
not,
it's very
no.
rare to find a pregnant woman eating completely meat.
Right. Well, and that's so I had really, really severe meat aversion at the start of that pregnancy, which was just like comical, right? Like, oh, of course, the carnivore lady gets meat aversion with her pregnancy. It was just kind of ridiculous. But I really couldn't stomach any red meat. So I had to go towards I did a lot of dairy products. I did a lot of like yogurts, but I also incorporated some fruit and I also incorporated some like condiments. So I would do like pickles or like some sauerkraut or just other things that would dress up my meat in order for me to be able to get it down. So that was, the least strict. And what's interesting was I only brought things in that I knew that I could handle. So right now, I stay relatively strict. I would say I am 90% carnivore 90% of the time, because it's what feels best to me. It's what works best with my lifestyle. Keeps my energy up with the kids, with my workouts, with my job. But I will say that I will have things. I have coffee, I have that. I
That's
have
very common, actually. And I think even when I was in Budapest, when they're doing the carnivore diet, when I saw people, so it's not completely, anti-carnivore. You,
right.
yeah,
It depends on what level you fall in the purity scale, right?
yeah,
People will say that hypercarnivore is if your diet is 70% or more meat-based or animal products, which is fine. And then you have the very strict end of the scale, which is lion diet, where it's literally just meat, salt, water, and it's ruminant meat, salt, and water.
yeah,
Yes, exactly. And then from there, you can even go more strict where it's raw lion, right?
yeah.
So there's various levels to all of this, and people in the carnivore space know that. And some people can be very dogmatic about it. I'm not the dogmatic type personally. I really am a proponent of do what is best for your individual system. And for me, if there's like a creme brulee, I may say yes to it. And it's arguably one of the most carnivore desserts, plus a little bit of
Yeah.
sugar. But the amount of times I have one, like I can probably count on less than five fingers in a year. Right? It's not a lot, but because my goal is I just want to feel good, and I know that eating certain things doesn't allow me to feel good and function my best.
Okay. Well, that's kind of very intriguing on, just, especially when you're going to like cream brulee, you're talking about like more quality fat.
Mm-hmm.
And as a former competitive athlete and fitness trainer in my years, it was very difficult to convince like a lot of my female clients that fat is not necessarily going to get you fat. Because I was doing kind of semi-ketogenic like during my competition days. So, I mean, do you have that like a problem with like a patient if they're talking about weight loss and like they're really convinced that they have to stay away from fat because they got manipulated by the fat craze from the like since the 1980s?
It is really hard to change that mindset in a lot of my older
Yeah.
patients, the ones who grew up mainly in the 70s and 80s, like you were saying, where everything was low fat and they're taught that eating fat makes you fat. And a lot of the time it's just about re-education. And how I usually like to frame it to them is they usually come into my office overweight, unhealthy, feeling terrible, and they've been doing low fat this whole time. And my thought process is, well, if it was working, it would have worked.
Yeah.
Right. So if what you've been doing is not getting you the results that you're looking for, why not at least try it my way for a few months?
Yeah. And I think, the proof's in the pudding. If you just kind of start eating some fat in front of them, like I got a beautiful doctor with an ideal body figure and she's eating a lot of fat, maybe I should consider. And I even tell a lot of my people, they're like, they see me eating raw bone marrow. They're like, that's just straight raw beef that not only you're gonna get fat, but you're gonna have parasites. It's raw. I'm like, no, this is grass-fed bone marrow from like Sprouts. And like, I get like I was at Grassland Farms and I don't know, it's like the most soothing thing for my gut. And I think that's where I think I'm really hoping we can probably change the curriculum for a lot of medical institutions to like, start teaching the doctors that fat is not the enemy. You should not demonize meat and fat. So, but one thing I do appreciate is from a naturopathic medicine kind of like, background is that you're you don't lean towards pharmacology as your main kind of treatment compared to a lot of I'm going to say conventional medical doctors. I don't want to make a blanket statement because I even told that with my client, Anthony Shafee. Like, no, it's not all doctors. It's the conventional doctors, the ones that think. So Where did you go to naturopath college? Did you go to NCNM up in
No.
Oregon? I think
I
it's
went to here in Arizona actually. It
okay.
was called SCNM, Southwest College of Naturopathic Medicine at the time.
Sweet.
It's since rebranded to Sonoran University of Health Sciences or something like that.
Yeah.
But that was yeah, that's where I went.
So do they, I mean, do they, because you're still allowed to prescribe medicine, pharmaceuticals as a
Mhm.
naturopathic doctor. So do you have any pharmaceuticals that are kind of like, not maybe safer, kind of like maybe like some people getting blood clots before ozone therapy, may they consider like heparin or something like that? I
Mhm.
mean, is there something that you would probably consider like a safer pharmaceutical than rather than the vaccines?
Oh yeah, there are a lot of safe pharmaceuticals, and I think this is where you have to kind of exist in the gray area because I think it is dangerous to be 100% dependent on pharmaceuticals,
Yeah.
just as it's dangerous to be 100% dependent on natural things, right? I give the example of a UTI. You know, some people say, oh, just try to treat a UTI naturally, but in some cases, a UTI can rapidly progress to kidney failure, which could ultimately
Yeah.
cause death. So there's a time and a place in my book, and it's really important to weigh the risks and the benefits of who's in the patient that's in front of you, what their needs are in that moment. Of course, you know, antibiotics, we say all day long, they'll destroy your gut, but you know, if it's a life or death situation, I'll take the alive
Yeah.
patient with a destroyed gut versus the dead patient all day long. But I do use a lot of prescriptions, and I will say the prescriptions that I usually tend towards are more on the bioidentical hormone side. We do a lot of peptide prescriptions. So even
I don't
though, you know,
consider those pharmaceuticals though.
but they technically are because you have
Yeah.
to have a medical license to be able to write the prescription. They're coming from a pharmacy. So they are medications in that regard. And ultimately, you know, we could even start saying that anything that provides a therapeutic change in the body is a medicine, right? Like,
Sure. Yeah.
you know, so beef tallow could be medicine for some people.
That's true.
And so the greater conversation is not to, I think, pigeonhole what's a good medicine, what's for us is a bad medicine. It's what's the medicine that that individual needs, and anything could be that technically. And it's usually not a statin. It's
Yeah.
usually not, you know, an opiate. But that's not to say that in certain cases those can't be the therapeutic thing for that individual.
Yeah. So, what are the most common peptides that you may prescribe for a lot of your patients coming in?
Great question. We use a lot of BPC 157, and we call that kind of like the Wolverine peptide. It
Yes.
is phenomenal for helping with joint healing, gut healing, kind of overall blood flow throughout the body, and it's really well tolerated by pretty much everybody. And it's really, really safe. They've actually never found like a toxic upper limit of it. So if people have acute issues, you can do pretty high dosing short term. Say if you have like a sprained ankle or something else has happened. We also use gosh, there's so many out there. We use for aesthetics. We use one. It's called the GHKCU or the
I
copper
know that
peptide.
copper. Yeah, exactly.
Yep,
And
and you
that's
can use
also an
that.
anti-inflammatory peptide too, right?
It is. So you, depending on sourcing, you can get it as a systemic injection administration, but we can also use it topically for hair loss, and we
Yeah.
can also use it topically on the face for wrinkles. And same with
Microneedling, right?
microneedling, you can do that for sure. And then I have even had some patients, you know how elderly patients, they get on their arms, like the skin gets very crepey and it kind of
Yes.
gets easily bruised. We can use the copper peptide topically for situations like that to help just add more integrity to the skin, which is lovely. And then one of my other favorite classes of peptides are actually the growth hormone releasing peptides. So
Secretary,
as
right? Yeah.
yeah, the growth hormone secretagogues. Yeah, so things like the sermorelin, CJC 1295, ipamorelin, tesamorelin. These are really, really cool products because as we all start to age, our amount of growth hormone production does go down. And growth hormone, you can pop into Google like benefits of growth hormone. You'll find a pile of things, but mainly it's going to help with keeping your muscle on, keeping fat off, keeping your hair growing, your skin healthy, your nails healthy, getting you deep sleep, helping you with recovery. It's phenomenal stuff. And we use these peptides to help the person release more growth hormone in their body at safe amounts. So a lot of the times we hear stories of these bodybuilders who took growth hormone for years and they end up getting these big barrel bellies, they get the
Yeah.
enlarged
GH
organs, the
gut, right?
enlarged heart. Exactly. And that's dangerous levels because they're giving themselves those super physiologic doses that can actually be harmful long term. But with these peptides, the doses stay safe because they're only stimulating your body to release some growth hormone. So it's always appropriate to what your body needs and can handle.
Yeah, and I've recognized that too because I think sermorelin is kind of like the only one that can really kind of tolerate it. Maybe it's kind of like a allergic reaction to different kind of like combinations. Like CJC 1295 gives me like a really bad red, but I've never taken growth hormones. I've had a lot of friends have, but I just noticed that yeah, their guts they got the bubble gut they call it. It was like the
Yes.
was it called the Palumbo gut like from the Palumbo
Yep.
bodybuilding? Yeah,
And what's happening is their organs are actually growing, so
Danny.
it's
Yeah.
pushing it out. And then you do bring up a good point. Some people can develop allergies to these medications, so sometimes it's important to rotate them or to limit your cycles. So some people that are more apt to respond to them with an allergy, you should only do a 3 month cycle once a year.
Oh, so that's you know what they don't really talk about rotating this too much, but I know that because I'm not sure if you're gonna be at Meatstock. I'm looking forward to seeing you there next weekend too. There is the what is it called the World Congress Peptide? It's like the Peptide Summit. Are you going to that one in Vegas?
Yes, so that's actually it's in June in Vegas. It's so
Yeah, June
funny.
13th, right?
I'm Yes,
I'll be
I'm
there.
there. I'm at that hotel, but I'm actually speaking at a stem cell conference that's happening at that same time. I may try to sneak in for a session or two because I have some friends that are going to be there. But yeah, I am very familiar with that world, and I will be physically there, just not at that conference.
Yeah, well, that's great to hear because my campaign manager, I just told her, Rhonda, she's really intrigued with a lot of functional medicine. First of all, she's already kind of trying out the carnivore diet since we went all these meetups and they're just serving my. She's like, "This is feeling a lot better. I'm just eating meat and I'm actually feeling better." I was like, "Yeah, those plants can cause you." But she's really intrigued on the peptides, and I just know that like if you go one of the companies, if I have to get it like really quick, it's a little bit more expensive. But Peptide Sciences,
Mhm.
you may be familiar with that, but I mean, it sounds like there's like hundreds, if not thousands, of peptides nowadays. It used to be just the BPC 157, like the thymosin beta, but now it's so many.
There's a lot right now, and there's a lot of companies that are popping up that are selling these that are these like research only pharmacies.
Yeah,
I can't like legally speak to those because um,
and not just that, they might not be purity because
they
I
might
know that,
not be.
yeah,
Yeah, the purity might be in question, the sterility might be in question, the potency might be in question. So these are all things that, the websites do say like not for human use.
for
So
humans, yeah,
um, I just don't recommend that people go to these if they can get with a doctor that can prescribe them for them. But there's the peptides, and there's a lot of peptides, and they're coming out with new ones constantly as they do more research. But they've also kind of gotten into the realm too of now these bioregulators. And so
yeah,
bioregulators are like baby peptides almost, we'll call them that.
yeah.
And they're just different sequences of these amino acids that still produce a signaling. But so now we kind of have two worlds of these things happening. And bioregulators, there's a little more flexibility in those because you can take some of those orally versus having to inject them.
Yeah. But injecting is the fastest way to get into your bloodstream, right?
Yes, it definitely is. And there are certain peptides that have to be done through injection because if you were to take them orally, they would just be denatured by your stomach acid too quickly.
That's what I understood too. Yeah, and now is the bioregulators. I understand there's like a lot of them. I think because I joined with some of these peptide groups, and I've attended like peptide summits for the past like 5 or 6 years because I got intrigued. I started off with carnivore, and then I started doing functional medicine afterwards. Is that there's a lot of bioregulators that certain ones will treat like each organ of your body. Is that correct?
Yes, exactly. So I'm personally experimenting with one right now called Pinealon, and it's supposed to help with the pineal gland and overall
Yeah.
cognitive function. So I'll have to report back on what my results are from that. And that's the thing. I like to experiment on myself before I usually give to patients, within reason, of course. I certainly don't take everything that I give to every single patient. But when it comes to experimenting with stuff like this that can be helpful with very low potential for negative side effects, I'm always on board.
Yeah, I think it was it. Prostamax is one of the other thing from peptide science is mainly like targeting the keeping down the inflammation of the prostate and more functional too. And I think what was the other one? There was pancreagen or something like that. It's spalate to the pancreas. So I thought that was really
Mhm.
intriguing that there's peptides. And as I understand, if someone just asks you what is a peptide, you're just like, well, it's kind of like isn't it combinations of amino acids put in a
Yep.
combination to produce some type of anti-inflammatory effect?
So not always anti-inflammatory, but it's always an amino acid that creates a signal. And so the way that I like to think about it, it's like flipping a switch. So most people when they hear peptides, they probably don't know that they're very familiar with some. So insulin is a peptide, collagen is a peptide. They're just
True.
sequences of
Yeah.
amino acids, and they do different jobs in the bodies. So when I frame it to people like that, they're usually like, oh, okay, I kind of get it now. But there's so many out there. The other ones that people are usually really familiar with, at least at this point in time, are the GLP-1 peptides. So the semaglutide,
Yeah,
tirzepatide,
exactly.
Mounjaro, Wegovy, Ozempic, all of those things people are hearing about a lot. And those actually, you were saying anti-inflammatory, people want to hate on these medications,
Yeah.
but they do reduce inflammation. They,
Microdosing.
yes, yes, I actually have been microdosing those since 2021.
Sweet. I know. That's why I told a lot of people that, yeah, because a lot of they're looking at the side effects. I'm like, yeah, those are
Mhm.
side effects if you're doing it at a really kind of like, a high dose. But if you're
Yep.
doing a very micro dose, I think it was like Natalie Nidham. I think she was one of the like the podcasters that speak of it.
Mhm.
She like, distinguished like even studies showing like micro
Mhm.
dosing compared to the normal larger dosing, then they didn't have the side effects of like stomach paralysis and anything else, correct?
Exactly. Yeah. And I should clarify, I'm not microdosing. I use them in patients.
Okay.
But yes, I'm very familiar with how
Yeah.
to use them. But yes, so the dosages that right now are in the pharmaceutical world and they get like the auto dispenser pens, they're really, really high doses. And yes, those are the ones that can absolutely lead to the side effects that you hear about in the news, like the stomach paralysis or the potential thyroid concerns or the other potential like pancreatic concerns. But when we use them in really small doses, my patients don't get any of those side effects. In fact, they usually get tremendous benefits that span. They sometimes even surprise me, the benefits that these patients get. Everything from being able to drop addictions, and I'm talking addictions from everything like really serious things like cocaine, alcohol, to even cheese. I had one patient and she's like, yeah, I just
Food
don't eat
addiction.
cheese anymore, right? She was able to completely give up that addiction. Even like pornographic and sexual addictions, like people just it just cuts these things out. So there's definitely some sort of action on these dopamine pathways by that medication. And there are actually studies that show that it can be neuroregenerative as well too, which is really exciting for things like early onset Alzheimer's, dementia cases, things like that. There's also studies that support that it does reduce inflammation in arthritic cases as well. So people that have arthritic knees, arthritic backs, things like that can actually benefit from the inflammation reduction with that too. And then, of course, you've got the appetite suppression, the craving suppression, and then the removal of that insulin resistance piece, which most people are so metabolically unwell that if we can kind of give them, in my eyes, like a leg up towards getting them out of insulin resistance. Because here's the one thing that I found is that patients, they can do all the right things, they can change their diet, but if their underlying cells are still behaving in a deranged way, sometimes you just got to send a peptide in there to kind of change that signaling up and get them out of dodge. And that's been a really useful way to use these peptides for me.
And yeah, that's what I'm noticing that, not only does it come with the peptide therapies to mental health issues, it's kind of like another thing that
Yep.
it's on the rise and that's something that really needs to be treated. And that's part of my campaign too, is just see like, how can we address the mental health issues? And I like the fact that there's some kind of regenerative medicine attacking that, but do you have a experience with certain patients where some of their mental health, a lot of their mental health problems are kind of attributed to their diet as well?
All the time.
Yeah.
All the
Do you find
time.
it a lot common and with vegans?
I actually don't treat a lot of vegans, of
Good for you.
course. My practice doesn't really attract them, right? Because people go to my website and it talks
Yeah,
about
carnivore.
carnivore.
Yeah,
We
carnivore
actually had
queen.
somebody that was like, yeah, I'm not going to work with you because you believe in eating animals. I'm like, bye.
Yeah, I'm
Go
like,
right ahead. Like this is totally fine. But I will say that before I took this stance, I did have vegans in my practice or vegetarians or people
yeah.
that were very much more plant based. And yes, they definitely had more health concerns.
Oh,
And I find that it's actually a lot easier to work with patients and get them the results that they're looking for when they are on more of a meat based diet.
yeah,
Makes my
because
job a lot easier.
it makes it a lot easier too, and it just makes your life a lot easier because you don't have any mental health patients. I mean, I really wish as an attorney I could convince a lot of my clients to go completely carnivore, but I think they're having the worst anxiety and mental health issues, and there's a reason why attorneys have the highest suicide rates of all professions. We're dealing with like some of the most psychotic people.
Oh,
Yeah.
yeah.
But don't worry, I discourage a lot of vegans because I have a Trump portrait in my office. And as you may know, I think what they say, like a Democrat is three times more likely, or a vegan is three times more likely to become a Democrat. They're usually in the same kind of
Wow.
category.
I had not heard that statistic, but I did see that there was some sort of news article that like if you eat meat, like it's something to do with MAGA or something like that.
Oh
I
yeah, we're demonized. You know, we want to make America great again, and you're all of a sudden you're an animal killer.
yeah.
One thing I was going to touch about the peptides is I noticed that a lot of I actually encourage a lot of my male clients. I'm one of the few attorneys that kind of gives them kind of some recommendations on their diet, and I like talk to them if we ever go out to lunch. Like, you're only eating meat. What is wrong with you? I was like, well, I'm still doing good on your case. I'm still functioning. I'm still doing well, and I think I'm doing looking fairly decent as I turn 40. But I realize a lot of them, and maybe it's their wives complaining to me, is like erectile dysfunction. As I understand, for a lot of the men, I was like, hey, not only just a lot of people improve their libido with a carnivore based diet, but there's some peptides, and I think what is it? Was it PT or is it PT or PT?
PT 141. Yeah, yeah.
Yeah,
It also goes by the name bremelanotide.
there you go.
Yes, you can get this as either a nasal spray or you can do it as a subcutaneous injection, and it's a libido stimulator. It actually works on, I believe, the melanocortin stimulating pathway. I'm
Yeah.
probably butchering that.
So,
But it works really well for both men and women. So women can use it too. And it's actually as a pharmaceutical for women that's been approved. So this is one of those areas where like peptides and pharmaceuticals merge and marry. But it's actually under the brand name Vyleesi, and it's approved for women for what they call, I think, hypoarousal syndrome. So for
oh,
premenopausal women who just don't have a libido, they have Vyleesi, which is PT 141, as a prescription. It's pretty cool.
oh, so I can take it to my date this weekend. All right, perfect.
That might be a little forward. I don't know what your situation
I'm
is.
very open, as you probably
Like,
have
try this
noticed.
nasal spray.
You know what? That's actually a funny situation because there's another one. What was that? Melanotin? Melanotin 1 and 2?
Melanotan, yeah,
Yeah.
melanotan 2, the spring break peptide.
What
Um,
the natural tan? I'm
it makes
Italian,
you
so I tan really
tan.
easily. So I don't really have to go into
Too.
tan beds, but I do get sun on the weekends when I'm out in Vegas. But anyways, but I actually tried that and I realized it had a very interesting side effect, which would help most men, but I
Libido.
don't have this problem. But I took like too much, and I had to go to court that morning. So you already know where I'm coming from. I was like, this gave me like the biggest erection that I was trying to hide, and I had to take a very cold shower, and I was like, oh my God, this is like I couldn't get. Oh, is that like a side effect? Is that's a common side effect of
Yes,
Motrin, right? Okay.
yes. So that's why it's a spring break peptide because it's going to make you tan. It's going to make you horny, and it's actually going to help with you burning fat. So skinny, horny, tan. The Jersey Shore peptide, right? Like
Yeah,
that's
they called me the situation.
that you definitely had a situation going on there.
Well,
No, it's fun though. But so that's one of the ones where one of the unwanted side effects, and I won't say your side effect was unwanted, but if somebody tends towards freckling, it will make freckles worse and like
okay,
little
yeah,
little
everyone.
dark spots worse. So I just always kind of preface people with that. Like, don't be surprised if you start getting freckles on here, freckles on your arms. Like those can definitely pop up with it as you start stimulating those melanocytes.
But it's kind of something to kind of improve your overall skin quality though too, right? Because I
It
was told that
absolutely.
I can treat like some like forms of skin cancer. Is that
I haven't used it for that. I don't do any cancer as part of my practice, so I'm
yeah?
not the person to ask about that.
Or skin
Um,
conditions.
Yeah, but you can definitely like a vitiligo or something. It could potentially help with that because it does stimulate those melanocytes. And that's the thing, when we talk about the difference between like a sunburn and a suntan, I kind of like to educate on this. A sunburn is a pathological process. You actually caused oxidative damage and
Yeah.
oxidative stress. You burned those cells. Whereas a tan is a physiological process and it involves the stimulation of those melanocytes to do what they are meant to do, which is to kind of change their hue and produce you get even production of anti-inflammatory molecules too as a result of that. So
Yeah.
it's nice.
Yeah, I learned to microdose the melanotin for a lot of different reasons.
Yes.
I never want to have that experience again. I had to really cover up with like a notepad in front of the court when I was gonna just it was
Like
very
you're a teenager again.
yeah, luckily I didn't get my bar license revoked that day, so it was all cool.
Like, sir,
So
it's a medication side effect.
yeah. So another thing I was going to mention too is that I know because I represent some of the functional doctors here in LA, and they talk about a lot of the peptides not only just for autoimmune conditions for like people that have Lyme disease, that's one of my kind of like subset is Lyme disease and co-infections, but also mold exposure. And they recommend two ones that maybe you can tell me more about: thymosin alpha 1 and
Mhm.
LL37.
Yeah, so thymosin alpha 1 is an immune system stimulator. And one of the ways that it works is by actually trying to stimulate your thymus gland to secrete more immature T cells, which are the regulators of your overall immune function. Normally, by the time somebody's about 18 or so, your thymus gland has kind of stopped producing more immature T cells, and the immune system that you have is the immune system that you have, pending, of course, any really big negative changes, like if you had a really intense mold exposure or you had a really severe trauma that caused an autoimmune disorder to develop. But that's why the thymosin alpha 1 can really come into play there, because if you did encounter that and there was some sort of damage to your immune function, we can actually get new immature T cells kind of coming out from that thymus gland again, which is really great. LL37 I actually don't use a ton of. But
Okay.
another one that's really good for mold exposure, they will do the VIP, the vasoactive intestinal peptide
Yes.
basal spray. Can kind of help with
That
overall
is
immune
very
function there.
powerful. I've tried that before, and I just
Yeah,
realized that I tried it at a higher dose, and like it almost like completely like I sort of have like a heart racing because my skin got really fleshy, but I can tell that I was kind of having a
yeah,
severe detox.
yeah. It can definitely be really powerful, and a lot of people don't even, they'll recommend using that towards more of the tail end of your mold,
Yeah, kind of get your kind
protocol.
of use your binders, kind of clear out too. So,
Yeah, because it can be really, really stimulating like that. Yeah, and then also KPV is another one too that can be really good for overall immune function and inflammation reduction as well.
and that's good for histamine as well too, right?
Yeah, yeah. So it's that histamine response with that reducing the inflammation from that
Yeah.
overstimulated immune system.
Although I'm not a medical doctor, I kind of recommend some peptide therapy for some clients. But I've had a lot of them kind of just tell me just based on testimonial that they had some allergies, they get sensitive to certain peptides. You remember talking about rotating, so they couldn't
Hmm.
take any BPC 157, but for the anti-inflammation, they could take BP like KPV like at high doses, never have any
Yeah.
kind of problems. So that's
Yep.
a good benefit too. So I gotta
Absolutely.
ask you, you were one of the only people that kind of give me good stem cells in my back, and it was like L4, L5, and right at my tailbone. Because
Yep.
I've tried stem cells and exosomes, but I never tried stem cells from my own bone marrow because I think you told me I did not have enough fat, so we had to get it straight from the pelvis, which was amazing. But
Mhm.
why is it that maybe it's just kind of like, individual where I responded better, but is it common where a lot of people don't respond to a lot of like stem cells and exosomes from others or no?
Not in my well, from donor tissue.
That's why.
Yes,
Yeah.
yes. I almost never encounter cases where a person doesn't respond when we do a live harvest from their own body. And
Wow.
that's why I do a lot of that, because I know it works. And if people are going to be coming in and they're investing their time and they're investing their money, I'm like, I'm going to do what I
Yeah.
know is going to work. And it's because a lot of the time, these donor products, we just don't know what's in them 100%, and we can't guarantee how many of the stem cells are going to actually be alive by the time they make it to the patient. And so when we're talking about these products, we have to understand that things function differently. So a stem cell is going to function differently than a growth factor, and that's going to function differently than an exosome. Okay, now all of these things can potentially be used, but when we're trying to decide, well, what is the action that we need in the area that we're treating, that's how we determine what it is that we need to inject. So certain situations, for example, like let's say like a mild rotator cuff tear, we may be able to get away with something like PRP, which is a more growth factor based product. And we could get away with, say, like a donated umbilical or Wharton's jelly product, because we know it's mainly going to be a growth factor based product. There may be a couple stem cells in there. We don't know for sure by the time it's thawed in the office and delivered to the patient. But when we're talking about really severe damage and degeneration or even autoimmune stuff or whatnot, we need the action of stem cells. We need how stem cells actually behave, because they can actually stimulate proper healing and repair. And they can kind of work as like a foreman on a construction site and say, we need new blood growth. We need more collagen here. We need more cartilage here. We need more, like, we need to repair these fibers. Growth factors don't do that. They don't have the ability to read the environment and then decide what gets to happen next.
Is that kind of like messenger RNA? Is that mRNA kind of similar?
So messenger RNA and microRNA are actually going to be found inside exosomes, which stem cells secrete. So a stem cell can go into an area and it can kind of read what's happening, and it can say, okay, I need to do this. I need to secrete that. I need to tell the other structures in this area what they need to secrete. And they can secrete exosomes that will carry this messenger RNA or microRNA as well.
Yeah. So since most of my kind of like legal work is in LA, and I'm spending like the other half of the week in like Nevada, so I'm not completely into Las Vegas right now. I'm actually in LA, but I know that there's a lot of I mean, you could probably imagine. You probably and you've been to LA. There's like 1,000 probably doctors that are just all kind of promoting, stem cells and exosomes, and they give us. But not all of them work. Is it? Do you think it's mainly just because the doctor, if it's how they're sourcing them, or because I have a lot of
There's
they said like only a few of them have actually worked.
there's layers to that discussion as far as why something didn't happen. The first layer is you have to diagnose your patient.
Yeah.
Like you have to figure out what's actually going on with your patient. And for a lot of doctors that just kind of got into this because it was something fun to do for them or something different than their regular practice, and they didn't actually take the time to understand the background of what we'll call regenerative orthopedics, which is you have to diagnose what structures are affected and then what's also generating the pain, because there's always the two components to that, right? You can look at an MRI and you can say, hey, yeah, this person has, disc degeneration at L4, L5, but the pain generator might actually be the facet joints. And
Okay.
so you always have to consider both. And so if the doctor is not actually diagnosing their patient or taking the full look at what's actually wrong with them, and they don't hit the proper structures, the treatment's going to fail. Okay, so that's the first level. If they miss that, it fails. Second level is okay, so let's say that they got the diagnosis right and they got the structures right, but they apply a product that's not going to behave the way that we need it to. Like, say we need it to behave like a stem cell, but they're putting in a growth factor based product, probably not going to heal. Okay, that's the other layer. The other layer beyond that is who is your host? Who is the patient? If you have a patient that is morbidly obese, a smoker, drinking all the time, hot, inflamed, terrible, they're going to be a terrible host for stem cells, and they're likely not going to heal as well as somebody else who is more, we'll say, metabolically healthy. And this isn't just me. I'm not being discriminatory. We actually have studies to back this up, and there are studies that actually show that, say somebody is more overweight or obese, their actual fat tissue on their body is a highly inflammatory milieu, and it'll actually make more inflammation in the system, which makes it a lot harder to heal from chronic injuries. So a lot of these places too, they'll just take anybody who's willing to pay. And they won't pay attention to, are they actually even a good candidate? We do have candidacy requirements here in our practice, and we do turn people away if we feel like we can't help them.
Well, I'm glad you brought that up because, there's personal experience, not even my clients and friends, because most of my true friends are still in the health and fitness industry when I was competing in bodybuilding. Because so I kind of make it a public statement. I don't like most attorneys. I think most attorneys are assholes, and a lot of them are beta males. I always kind of call it that. But a lot of them are kind of telling me the different experiences that it's. And I was also concerned about if they do get stem cells, even if they are metabolically healthy, where they're sourcing the stem cells or
Mhm.
exosomes. That's probably another component too, correct?
Yeah, the sourcing does matter. And a lot of the companies, there's there's not a lot of different ways that they can make these products. It because of the FDA's regulations. So they are limited. And so yes, it can vary, but not that much. Some companies might be a little more or less concentrated than other companies, but they're generally producing very similar things. The other aspect of that selection criteria is some companies will test their donors for the COVID vaccine, some won't. So paying attention to even things like that too can be helpful.
Yeah. Is it based on your experience that people that got jabbed with the vaccine may have kind of a lesser quality?
It's actually people that received it. I sometimes have a harder time getting them to heal and respond.
Yeah.
Not to say that they don't, but they tend to, maybe their results don't last as long. Sometimes we have to do a lot more work on the front end to get them to be in a better place to receive the stem cells. So sometimes we'll have to do hormones, supplements, other things to really kind of bolster their system so
Yeah.
that when they finally do get to the stem cells, they're in a much better place.
Okay. So going back to like getting your stem cells from your own body, because I thought that was like the most amazing thing. Because you told me I didn't have enough fat, because I think you said you have to have like a stick of butter when you grab their back or something. Is that you said?
Yeah, about a stick of butter, yeah, on each
Yeah.
side is what we like to comfortably work with.
All right. But anyways, I'll work on that. But you went straight into the pelvis, and that's where the bone marrow is, right?
Yes, we did extract your bone marrow,
Oh,
and it's a lot easier. People are probably listening to this and cringing, like, oh, it sounds horrible. But as you know, you're
oh, was that?
numbed up. It's not bad at all, and it's super fast. You know, we get you numbed up really nicely. I think the whole extraction process was maybe 5 or 10 minutes tops.
Yeah.
Tops.
And I
It's
didn't
really
scream
fast.
like a little bitch, right? Is that part
Not
of
at
the
all. No, you know, you were great. But so once we extract the bone marrow, we do use a centrifuge to kind of separate out the components and kind of isolate the cells. And then from there, we did perform your injections, and of course, we use an ultrasound to do all of the injections, so we can make sure we're being precise.
Now I'm actually glad doing ultrasound guided injections because that's something I've always kind of like admired since kind of studying like looking into functional medicine since
Mhm.
2019 or something like that. But folks, just for kind of like a transparent kind of disclosure is that I personally went to Dr. Solt like in last year. And I was in a lot of back pain, and I went to a lot of different doctors before, tried PRP, stem cells, exosomes, some other ones. Didn't have any final relief. I even was, you can ask anybody like in LA or Vegas, I was completely limping around. I couldn't move. And after treating with Dr. Solt, and basically, one of the painful things was my tailbone too. But she treated my L4, L5, and right next to my tailbone from my own bone marrow. And I gotta say, I've never felt better. I even went skydiving like 2 months later. I think I scared your assistant Kelly because I was like, hey, I'm probably going skydiving. Like I used to do a lot of skydiving. I was gonna do skydiving in 6 weeks. She's like, you may want to wait a little longer and let that shit heal, but. Actually, I may need to see you again. I'm hoping this stays put. I want to say, but I just signed up. I told others, and we're gonna make it more. It's actually gonna be in Texas in September. I'm actually signed up for. I'm taking a dare. I'm doing professional bull riding, and I think that can like not just a Bronco. The Broncos are safe for the bulls, but I'm guessing they're gonna squeeze the bulls, testicles really tight to make sure they go crazy. But we'll be on camera, so that's a stunt. But I'm hoping I can make it through the campaign.
Well, if anything does happen, we obviously know that you do respond well. So if we need to fix
Yeah.
things afterwards, we can definitely fix things
No,
after.
I trust it. And I always kind of told you I usually don't like needles going in close to my ass for my tailbone because there's a tailbone, as you know, it's a pain. It's when you travel, you're just sitting on it 24 time. It just like, and I think I was going back and forth. It's just, yeah, it's literally a pain in the ass. But I'd always feel comfortable. I'm only gonna let you get close to my ass with a needle. So appreciate it.
I'm honored. Thank you so much.
Gotcha. So, anyways, well, I'm so glad you're going to be at the Peptide Summit because that's something we're going to be a little bit attending to, and we'll have some of our campaign team. I think it's at the Wynn Hotel, right?
It is, yes.
Yeah,
Love
I
that
don't know.
hotel.
I'm gonna be there. So I'll see you at Meat Stock because everybody's lumped there. But now, so if people want, I'm already kind of referring people to you, and I was like, hey, just take a Southwest flight anywhere and just go over to Phoenix, and it's just a quick one, and it was amazing. You probably just spend there a couple hours at most and fly back. But if people want to find you, where can they find you?
Yeah, if they're interested in clinical stuff, as far as becoming a patient or seeing how we can help them, they can go to www.stemcelltherapypro.com, and that will bring up the clinic's website, and you'll be able to sign up for a free discovery call in there with my team, and we'll be able to tell you if we feel like we can help you. And then for me personally, I'm most active on Instagram as far as social media goes. So I'm just at Dr. Solt, DrSolt on there.
Okay, gotcha. You know what? I gotta see what's happening because I originally was on LinkedIn, a little bit of Facebook. My manager set me up on different platforms, but I have no idea what she's posting, so I'm really gonna check that out to see what she's posted on mine. Yeah, but one last thing I'm gonna finish up before we conclude here, Dr. Sol, is that part of my campaign policies is first of all, make America not only great again but healthy again. But I spoke with Dr. Kiltz, and I've actually had a conversation with Dr. Barry and my client, Dr. Shafee, and Dr. Baker about it should be worthwhile to get more of our tax dollars to be spent properly instead of $50 million of condoms to Gaza, and it's disputed on whether $8 million went to transgender rat surgeries and who knows else. But I've actually promoting to get some more subsidies for American hardworking farmers to get quality meats, but I wanted to do more clinical trials. Do you think it would be more advantageous if we get more federal funding, our tax dollars, to pay for clinical trials to prove that a lot of these regenerative medicine techniques would work?
Absolutely, and I'll tell you why. Because right now, a lot of funding for studies is done by pharmaceutical companies that have a vested interest in a
Exactly.
drug succeeding so they can make money going forward. When we're talking about healing using a person's own cells, nobody wants to fund that because nobody can make money by marketing
Exactly.
it or patenting it, right? So this is absolutely where we need funding to come in because You and I, we know it works. I, of course, know it works. This is what I do day in and day out and have been doing for about a decade. I know it works, right? And we are referral, we are word of mouth, and we've been doing this for a long time because it works. But yes, if we had more studies backing it up, really well done studies, there of course are plenty. We have lots that are out there right now, but there's always more that are needed. And I think that this would be a really big step for getting it to be more widely accepted as at least a first stop for people before they undergo surgery or even things like cortisone injections.
Yeah, well, I'm gonna definitely make that part of my campaign because
I like
I did
that.
make it a public statement. I think I made it televised. Is that there's concerns about all the everybody's asking where's the research? Well, yeah, all the clinical trials they're all funded by big pharma who have the most money, and it's almost like a monopoly in like the pharmaceutical medicine world where they have the money to buy out and pay out all these clinical trials. So it's always going to have some type of bias. Correct?
100%, no matter what. For me, when it comes to pharmaceuticals, my biggest concern with those studies is it safe, right? And that's usually where they start, the safety studies. With stem cells, we know they're safe, right? Like we know that. So now we do need to prove efficacy, and we need to prove efficacy kind of across the board in all the things that we're already using it for, things like knees, hips, low back, shoulders. And I think that would be a really great place to start.
And hopefully the health insurance companies will start covering that if we can prove that it's, benefiting from the clinical trials.
Yep, which would ultimately make it more accessible to more people and allow more people to get healthier.
Awesome. Hey, Dr. Solt, it's an honor and pleasure to have you. And thank you once again for having me on my show. I'm looking forward to seeing you at Meatstock, and I'm looking forward to you see at the stem cell, convention back at the Wynn Hotel next month. So thank
Yeah,
you very
awesome.
much. Have a lovely day, and I'll look forward to speak to you soon.
Thank you. Talk to you
Bye.
soon.